The Newsday continues here on One News Now. I'm Charles Lejano. A number of healthcare workers from the St. Luke's Medical Center walked out of the hospital for a 10-minute demonstration earlier today, which coincides with the celebration of National Heroes Day. Greg Gregorio now joins us live from Quezon City to tell us more about this. Greg, good afternoon. Could you tell us what the primary concern of the health workers was?
Charles, the primary concern of these healthcare workers are the immediate release of their special risk allowance, as well as their meal, accommodation, and transportation allowance and life insurance, which according to them are due for the healthcare workers under the existing laws and amid our response against the COVID-19 pandemic. Charles?
Greg, I understand there is a disparity between the available funds and the number of people who are entitled to this. In St. Luke's alone, how many health workers have yet to receive their special risk allowance?
Charles, according to Jao Columia, president of the St. Luke's Medical Center Employees Association, none from their employees have received a portion of the 311 million pesos released by the Department of Budget and Management and Department of Health, which is supposed to pay the special risk allowance of about 20,000 healthcare workers. Columia said about 60% of their employees are eligible for SRA. Some of them have received SRA during the first release last year, but many of them are still waiting for the payment of their SRA. Charles?
Greg, could you tell us what exactly do the health workers from St. Luke's want from the DOH? What are the precise steps that they want the DOH to take?
Charles, first they want their SRA and MAT allowance to be released immediately. But apart from that, they want Secretary Francisco Duque to resign from his post. According to them, this is because of the non-issuance or the lapses of the Department of Health to show support for healthcare workers like them, which is reflected for them waiting to receive their SRAs and other benefits due to them. Charles?
Greg, have we heard from the health department as regards the calls of health workers to distribute their long overdue benefits?
Charles, the Department of Health has earlier explained that the 311 million pesos budget for the SRA of 20,000 healthcare workers have already been downloaded to their regional units and other government and private facilities for the immediate distribution of SRAs of these eligible healthcare workers. But apart from that, Health Undersecretary Maria Rosario had earlier mentioned that the department is still accepting submission of lists from facilities for the additional healthcare workers among their ranks who are eligible for the SRA. Vergere on Saturday reported that about 17,000 more healthcare workers have been recorded to be eligible of SRAs. With this, the department has already requested for an additional 200 million peso budget from the DBM to pay for the SRA of these additional healthcare workers. Charles?
Greg, are we expecting more health workers to stage protests in the coming days? What have you heard so far?
Charles, we were able to talk to the employees of the St. Luke's Medical Center as well as the health workers from the National Kidney and Transplant Institute, who just recently ended their activity earlier this afternoon. And according to them, more healthcare workers will be joining the mass protest on September 1, which they call their National Day of Action. Today, those employees who joined their protests are either off-duty or night duty. But according to the official of the Alliance of Health Workers, whom we were able to talk to, on September 1, even those who are on duty will be joining their protests. But in order to appease the concern of the public as to the possibility of hampering the operations of the hospital, they say they would maintain at least a skeletal workforce for them to cater to the needs of admitted patients. Charles?
Thanks for that, and stay safe, Greg. That was Greg Gregorio reporting live from Quezon City. The OCTA research group predicts that daily COVID-19 cases in Metro Manila will start to decrease by next month. Research fellow Guido David explained that cases are still rising because we have yet to feel the impact of recent lockdowns. But David said the numbers are expected to decline once the reproduction rate goes down below 1 threshold by mid-September. Reproduction or infection rates refer to the number of individuals or patients infected with COVID-19 passes the virus to.
So, ibig sabihin, bababa na yung hawaan or bababa na yung bilang ng kaso pagdating of September. Pero sa ngayon, dahil hindi pa siya bumababa less than 1, tumataas pa rin yung bilang ng kaso.
Countries from Europe dominated Bloomberg's COVID-19 resilience ranking for the month of August, while 5 countries from Southeast Asia landed on the bottom of the list. Let's watch this Bloomberg quick take.
So in the August COVID resilience ranking, we see European economies ranked 9 out of the top 10. What's really driving this, though, is actually how the Delta variant has just challenged and defied the success models of so many other places. So, for example, that COVID zero fortress-like containment model that we saw out of New Zealand and Australia, Delta has infiltrated those defenses and put those places in lockdown now. At the same time, on the other end, the vaccination and reopening champions that we saw, like the US and Israel, that were just moving so quickly with inoculation and reopening, they've also now seen new surges of Delta, seeding a concerning a number of breakthrough infections and sending unvaccinated people into critical care wards. So what that's meant really is that Europe has emerged in August as the most resilient group of economies based on this sort of middle ground strategy of widespread vaccination and reopening tied to vaccination status. But what we don't know, of course, is how long this can hold, because we did see that good dynamic happen in some of those other vaccination champions as well previously, and now they've been inundated with Delta. What we're seeing in the August ranking, as has been happening for several months now, is that the bottom of the ranking is very much populated by developing countries because of their lack of access to vaccines. Rich countries have really dominated that supply of vaccines, and now we're seeing places talk about another round of booster shots, which is going to hoover up even more of that limited supply and continue to leave so many of these developing countries unvaccinated and vulnerable to Delta without a shield of inoculation. So at the bottom of this ranking, we're seeing countries in the Southeast Asia region. This region as a whole has emerged really as the new global hotspot for the virus. Southeast Asia as a whole had the highest death toll per capita in the past month. And number 53 is Malaysia, where per capita new infections is one of the highest in the world. And because of the situation with Delta, the central bank in Malaysia has halved their economic forecast for the year, and that's really brought down their ranking as well. So one of the most sobering things that has happened with the rise of Delta is that people realize that this pandemic is not coming to an end, and in fact, we're merely perhaps at the end of the first phase, and Delta has very much brought in a new phase of the challenge. What could be positive examples to look to in the ranking, though, is the example of the Netherlands and the UK, both of which rose in the rankings and are amongst that group of European economies doing well. So what we've seen in those places is, while their Delta waves did surge in quite great proportion, those waves went down without a big rise in fatalities, and they have seen those waves wane without disrupting reopening progress. This is hopefully what we're going to be seeing in places like the US and Israel as well, and this round of booster shots that are coming out will likely help them to continue to keep fatalities down as they reopen, because as we do know, the Western economies very much have said they're not going to turn back the clock. They're not going to go back into lockdown. Reopening and normalization is the way to go.
We'll bring you more stories after a quick break. Keep it here. You're still watching One News Now. I'm Charles Lejano. Manila Mayor Isko has faced the public for the first time after recovering from COVID-19. To give us more details, we have Romel Lopez reporting to us live from Manila. Good afternoon, Romel. What is the latest from Mayor Isko?
Charles, Mayor Isko Moreno led a groundbreaking event for a housing project in the city. In his speech, he took swipe at an unnamed family whom he said is making politics a family business. The event was held in San Andres, Manila, where a 299-room condominium will rise soon. The Pedro Hill residents will cater to renting and working-class Manileños as well as informal settlers. The 20-story building will have complete amenities with a monthly amortization of 2,000 pesos. In his speech, Isko reminded public servants in attendance about the importance of serving the people and not those big names whom he said are making Philippine politics a family business. He added that he will not force himself to stay in office as there is no such thing as perpetuity in politics. Isko also broke his silence about his old sexy photos that were criticized by President Duterte. Although he did not mention names, Mayor hits his critics, saying that they should focus on COVID-19 response instead of allotting time in browsing his old sexy photos taken when he was still an actor. Let's hear more from Mayor Isko.
Kung busy yung mga tao, imbis na busy sila sa COVID-19, natingnan yung picture ko sa gabi, maraming salamat. Kasi mas attractive yung aking brief kaysa sa problema ng bayan. So, I'm honored. But I'm not happy.
Charles, Mayor Isko did not confirm whether he will seek a higher post or will he run again as mayor of the city of Manila. Charles?
Thanks for that, Romel. That was Romel Lopez reporting live from Manila. Let's take a quick look at today's other top stories. Senator Bongo has officially rejected his nomination to be the standard-bearer of the ruling party PDP-Laban party in the 2022 elections. In his letter to PDP-Laban President Alfonso Cusi, Go said that he would rather focus on his chairmanship work at the Senate's health panel, and Cusi is set to announce the faction's standard-bearer on September 8th. The International Criminal Court, or ICC, has found that an overwhelming number of victims support its request for a probe into President Duterte's war on drugs. The report from the ICC registry showed that 94%, or 192 of the 204 representatives, said that they want the Office of the Prosecutor to conduct a full-blown investigation into Duterte's alleged crimes against humanity. They added that a real probe by an impartial international court could bring perpetrators to justice and put an end to impunity. And in sports, swimmers Ernie Gawilan and Gary Bihino failed to advance to the finals of their events in the Tokyo Paralympics. Gawilan finished 10th in the men's 100-meter backstroke S7 event after clocking in 1 minute and 21.6 seconds. And Bihino landed 14th place in the men's 15-meter butterfly S6 preliminaries with a 36.14-second finish. While Gawilan concluded his Paralympics campaign, Bihino will still compete in 2 events this week: the 400-meter freestyle S6 and the 100-meter backstroke S6. For more updates, visit News 5, the Philippine Star and Business World online. Do visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Charles Lejano. We are One News.